This is Betty. She is one of my subscribers, and here she is pregnant with twins. This is the day before she planned her unmedicated vaginal twin birth, with one of the twins being breech. When I heard her birth story, it was so crazy with so many twists and turns and things that she had to overcome. I just had to share it. After going through an unmedicated vaginal birth for one baby, I honestly cannot imagine the doctor saying, all right, and now you have to birth another entire baby. However, Betty really wanted a vaginal birth. When I asked her why, she said that she had an extreme fear of an epidural and a C-section, so she was really motivated to go ahead with a vaginal birth. When she first found out that she was having twins, she thought that she was going to have a C-section, but then she found out that C-sections with twins are actually usually elective. If you can find a doctor that is confident in a twin vaginal birth, then you can make it happen. But her first barrier was that there wasn't any doctors willing to do it in her area of California. However, she also had family in Minnesota. Her midwife from her previous birth helped her find a physician in Minnesota, which I Google mapped it. It's a 30-hour drive away, that was willing to do a twin vaginal delivery. As Betty is getting closer to her delivery date, baby A is in a great position, head down. However, baby B is still breech. If it was the other way around and baby A was breech, the doctor would not do it. However, the doctor would still do it even if baby B was breech, even though it's not ideal. It's also better if the first baby, baby A, is the bigger baby. However, in her case, baby B is also the bigger baby. It is now 36 weeks and 5 days, and unfortunately, baby A is dropping off the growth curve. The doctor says this is not safe for baby A and wants to induce Betty. Remember, Betty is very fearful of an epidural, of interventions, and a C-section, and when you are induced, it increases the risk of all these things, and this is not good news. If a mother is induced with Pitocin, Pitocin can cause contractions to be more painful and intense because they are coming faster and stronger. And with induction, there is increased risk of interventions, which is exactly what Betty is fearful of. Her doctor checks her cervix, and thankfully, she is already 3 centimeters dilated and 60% effaced, which means the cervix is also thinning. Now, Betty has a stretch and sweep performed, which means that the membranes of the baby's amniotic sac are separated from the wall of the uterus. Then she goes home with a plan to return in the morning. So that night, of course, she does all of the natural labor induction techniques. If you're looking for those techniques, I'll link to it right there or in the description box below. Fast forward to the morning, it's now 6 a.m. and Betty and her husband are at the hospital. She has continued to dilate and efface overnight. However, they still need to start a low dose of Pitocin. At 7 a.m., they started a low drip of Pitocin at 2 milliliters per hour. At 9:45 a.m., so almost 3 hours later, Betty is 6 centimeters, 90% effaced, but she is not having any contractions yet, and her doctor requests to break baby A's water. Another hour later at 10:45, now contractions have started and they are getting harder, and Betty is having to implement her breathing and natural pain reduction strategies. She's bouncing on her birth ball. She also has a birth pool, so she's using water as a pain relief technique. And then also her husband is helping her do the double hip squeeze, which is helping to relieve a lot of the pain. If you want to learn more about pain relief strategies, I have my complete guide on how to reduce and cope with pain during labor, and I'll link to that in the description box below as well. It's now 12 p.m., another hour and 15 minutes later. Betty has been working really hard. Contractions are prolonged, they are intense, and all of a sudden she feels the sudden urge to urinate. But she doesn't actually have to urinate, so she hops back into the birth pool, and then she feels that strong urge to push. She says, I need to push, and all of a sudden, within 2 minutes, her birth team of 9 providers are assembled in her room. They help Betty get on to the bed. They confirm that she is ready to push. Baby A is right there, head down, ready to go. So she's got one doctor helping her with baby A, and then another doctor has hands on her stomach, ready to flip baby B because baby B was breech. In just 2 contractions, Betty pushes out baby A, and baby A is a girl. Congratulations, and now they put baby A on her chest. The focus goes towards baby B. Right away, the doctor with hands on her belly is pressing and flipping around baby B so that she can birth baby B head down. This is called external cephalic version, and at this time they also break baby B's water. 5 minutes has gone by, baby A, or the baby girl, is on Betty's chest. At that time, they decide to clamp and husband cuts the cord for baby A. Right after, baby B is now flipped, and the doctor tells her, Betty, you have to push with all of your might to lock baby B into place. During her next contraction, she pushes, she's doing an amazing job, and in just 11 minutes, baby B is born, and baby B is a boy. She did it. That was so crazy. She vaginally, unmedicated, birthed twins when one was breech. Betty is an absolute superhero. Congratulations, Betty and family, and thank you for sharing your inspiring story. Betty can see the comments, so make sure to give her a thumbs up and send her some love and encouragement in the comments. Also, don't forget to subscribe for birth education and pregnancy workouts for a healthy pregnancy.